Hi, my name is Caitlin, and I'll be presenting to you today the work that I've been doing over the past few weeks on preventing Hib disease in Chile. The basics of Hib disease. According to the Meningitis Research Foundation, Haemophilus influenza type B, commonly known as Hib disease, is one of the leading causes of bacterial meningitis and pneumonia in children worldwide. Hib is a bacteria found only in humans and resides in the nose and back of the throat. Infection spreads through mucus and respiratory droplets from carriers of the bacteria. Majority of carriers do not become sick, and the majority of carriers are children under the age of 5. Researchers estimate that Hib is responsible for about 450,000 deaths worldwide, with at least 2 million cases occurring each year. Hib meningitis kills 20 to 40% of the children who contract it, and half of those who survive are left with severe physical and or mental disabilities such as deafness, mental retardation, central nervous system deficits such as seizures. Hib meningitis and pneumonia. According to the Centers for Disease Control and Prevention, Hib is diagnosed by testing a sample of blood and or spinal fluid. A variety of antibiotics are used to treat the disease depending on the severity. For serious infections such as Hib meningitis or pneumonia, hospitalization may occur. Symptoms of Hib meningitis include but are not limited to sudden onset of fever, headache, stiff neck, and or altered mental status. Hib pneumonia symptoms can range from fever, cough, shortness of breath, muscle pain, and or fatigue, as well as other symptoms. Global importance. In sub-Saharan Africa, 200 per 100,000 children up to the age of 11 months develop Hib meningitis, compared to 60 per 100,000 children in the Americas. On average, the fatality rate for Hib meningitis is 14% globally. However, there are large differences between wealthy and poor countries in children's chances of surviving the disease. Industrialized countries, the fatality rate is around 3.2%, whereas in developing countries, it's around 17%. Evidence of need in Chile. Chile has a modern infrastructure with efficient immunization services, with 95% of children becoming fully vaccinated. In the late 1980s, researchers for the Ministry of Health determined Hib to be a public health concern and started to work towards implementing a vaccine. They determined the peak age of infection to be between 6 and 11 months, with the risk declining after the first birthday. During the time of this study, the fatality rate for Hib meningitis was at 16% in Chile. Assessing the feasibility and effectiveness of national Hib immunization. 2 Hib conjugate vaccines were licensed in Chile in 1992. However, they were not introduced into the routine immunization program until 1996. The Ministry of Health didn't justify the cost of the vaccine until 1994, when evidence of the disease burden was shown to be significant. In 1994, the ministry agreed to allow the vaccine to be used by researchers to see the effectiveness on a large population of infants. The results were positive. The number of meningitis cases reduced by 91%, and the pneumonia cases reduced by 80%. The ministry then entered the vaccine into the infant routine vaccination program throughout Chile starting in July of 1996. The affordability, sustainability, and public demand. Public demanded the vaccine against meningitis. The cost initially accounted for approximately half of the country's total immunization program. By 2003, that figure fell to 22.9% of the immunization budget, costing around $3 a dose. Under Chilean regulations, vaccines are considered a public good and are provided for free to the Chilean population. According to Denvario et al., following the implementation of the vaccine in 1996, 95% of infants received the first dose by the 2 months of age. Average income per year for the people of Chile is about $5,220, which qualifies Chile as a middle-income nation. However, the Pan American Health Organization states that since 2013, Chile has become classified as a high-income nation. Economic growth has increased, as well as the average years of education has increased to 10.8. According to the Pan American Health Organization, Chile has a mix of public and private healthcare system. This has caused the system to be fragmented within the finance and delivery sectors since they are separated by private and public. Due to this, there's unequal availability of resources throughout Chile. Ministry of Health and the National Health Fund. Both organizations work together to fund private health resources and manage the national health budget. The Ministry of Health introduced the HIV vaccine into the routine vaccination in 1996. The National Health Fund manages resources in the national health budget. The HIV vaccine only accounts for 0.7% of the government's entire health expenditure, costing about $3 a dose per person. Although through general taxes, vaccines are provided free to all Chilean people. Global organizations, Gavi and WHO. The Gavi works around the globe to aid developing countries in creating vaccination programs and educates the public on the importance of receiving the vaccination for HIV. Gavi works alongside other organizations to organize and fund transportation of supplies throughout the developing countries. The World Health Organization, or WHO, develops guidelines and recommendations for countries around the world for HIV as well as other diseases. WHO's current recommendations for HIV vaccine is for infants to receive the first dose by the age of 2 months and to complete the series between 12 and 15 months of age. WHO also funds many programs within countries in the aid to eliminate HIV from the globe. Prevention. Prevention of HIV disease is for infants to receive the vaccine during the most vulnerable time, which is under the age of 11 months. HIV disease can be eliminated through the use of vaccine. Gambia is proof of this since they have not seen a case of HIV meningitis since 2002 and have seen few cases of HIV disease thanks to the efforts of the Gavi and the programs it has helped to fund. Being one of the poorest countries in the world with an average income of $280 per person, with an infrastructure less developed than Chile, Gambia has an infant mortality rate of 90 per 1,000 births, with 10% of the population having to walk 7.5 kilometers to the nearest healthcare facility. In 1990, 200 per 100,000 children contracted HIV, and it struck at a younger age with more severe severity, with a third of cases not surviving the disease. A study was done from 1993 to 1995 for a HIV vaccine and yielded results showing that the vaccine was highly effective with 95% fewer cases. A 5-year study was done and the occurrence of HIV dropped to 21 per 100,000 children in the first year, and then by the end of 5 years the occurrence rate was 0. No cases have been reported in Gambia since 2002, with receiving 2 doses being 95% effective against the disease. Gavi funds a program known as Every Child Counts the Gambia. The program was created by the Shifo Foundation. It educates the Gambian people on the importance of immunizations for infants. It registers infants in an immunization program and currently has more than 200,000 children enrolled, with more than 50,000 children completing the program. It's important to note programs like this in the Gambia have created a positive impact in the reduction of HIV disease. Chile does not currently have any programs such as this due to the private and public health system. In conclusion, millions of people are affected by HIV disease every year, which cause more severe infections such as meningitis or pneumonia. Through the use of vaccines, Chile has seen a dramatic decrease in HIV, which is also provided to the people for free. The most vulnerable children are under the age of 5, specifically under 11 months. For those who contract HIV meningitis, there's a 5 to 10% mortality rate, with 30% of those who survive having permanent central nervous system damage as well as other physical and mental deficits. Vaccines have decreased HIV disease occurrence in Chile by 90% since the implementation of the vaccine in 1996. Countries like the Gambia have seen almost complete imminent elimination of the disease through the use of specialized programs such as Every Child Counts the Gambia, which registers infants into an immunization program. Global organizations also help fund programs around the world in an effort to spread awareness and importance of vaccinating infants against Hib disease. Organizations like Gavi have prevented more than 13 million deaths and have vaccinated more than 750 million children against Hib disease. If you have any questions about the prevention of Hib disease in Chile, please feel free to email me with the email provided in this presentation. Thank you.